You're watching Cable 2.
Welcome to the Winston-Salem Forsyth County Special Call Board Meeting. This meeting serves the purpose of convening the COVID Board of Education Subcommittee. Today is Thursday, August 13th, 2020, and this meeting is being held virtual. We'll turn it over to our committee chair, our special committee chair, Marilyn Parker.
Good afternoon. We welcome everyone to this committee meeting. So we will continue to have these periodically as we go through remote learning and getting updates and planning for the future when we can have in school classes again. So, Dr. Hairston, would you like to do our roll call to establish a quorum, please?
Yes, ma'am. Marilyn Parker.
Present.
Okay. Andrea Bremer.
Present.
Dana Jones.
Present.
Elizabeth Motsinger.
Present.
Deanna Kaplan.
Present.
Thank you.
All right, great, thank you, and thanks to all the members who are joining us, as well as any of the public that we have joining us tonight. Our first discussion item is CARES team update. Michael Pesci.
Good evening, board members, Chair Woodbury and Dr. Hairston. We're glad to have this opportunity to provide a more in-depth report on the CARES team progress. We've been working quickly to get all of the team members in place and trained, as well as establish the learning centers. We're going to give you an overview of our activities this evening, beginning with Deborah Harris, who's going to talk about the various CARES team positions.
Board members, Dr. Hairston, I'm going to give you a brief overview of the CARES team positions. First, at the district office, we have the assistant leader, and they are the point of contact between the community-based CARES team and the school-based CARES team. And so they will maintain that communication, they'll review and assess and coordinate the referrals, and they're going to ensure that the family receive the necessary resources that they had incurred. Next, we will have the school-based CARES team, and the principals have registered a minimum of 5 staff members to be on the school-based CARES team, and they have 1 certified person that is the lead, and that lead will also work with the assistant leader at the district office, and the lead will facilitate CARES team weekly meetings so they can review the referrals and also designate resources that are available through the school. And then for our community-based CARES team, we will have our community leaders, liaisons, and we'll have 5 of those. And we have divided the county into 5 different areas, and so they'll be assigned one of the areas, and they will connect with the families and also connect with the community. We have our parent assistants and our interpreters, and they will go throughout the county interpreting skills. We have them for Spanish, and we will also have a company that we work with if the language is other than Spanish. We have technology assistants, and we have 2 of those, and they will be going around to the remote learning sites, and they'll also be going to the homes when necessary to provide tech support. And then we have our community teachers, and we're having 30 part-time teachers, and they will be going to the different remote sites, and they will be helping with direct services and direct support for those students that need it. Michael?
Great. Yep, thank you. And apologize, I don't know if you can see the slides. I cannot. I'm asking Sam if there's a way he can pull those up while we're speaking.
Yeah, we're not seeing the slides.
Okay.
Yep, I'll pull them up.
Okay, thank you, Sam. Appreciate it.
So,
And
can I ask a question now about the?
Yeah, I was, yeah,
Sure.
Because sometimes it gets so far into it. So, do we have the? I know we're working on 30 plus sites. Do we have that list yet available, or for parents, or I know that there's so many parents that are just really anxious right now about what are they going to do, and even if they have maybe the child staying with grandma or a neighbor or something like that, but giving them that kind of support that they may need with the lessons and that sort of thing.
that's something that Effie McMillan's going to be covering. We can do that now, or?
No, it's part of the thing. We can do it.
Yeah,
It's no problem.
it is. We're going to come to that in just a few minutes.
Sam, were you going to pull up the slideshow?
Oh, you don't see it?
No, we just see the agenda.
Agenda page.
yeah,
Oh.
and then it looks like, yeah, you could do that. In the meantime, does anyone have any questions that you know of right now for?
There we go.
Okay.
Go.
So this is a list of that Ms. Harris just reviewed, the district-based, school-based, and community-based.
So you can go to the next slide. Okay, and I'm going to talk a little bit about the referral process and how we're going to monitor the cases throughout the year. So the goal is to ensure that students are connected and engaged in remote learning. That's our overall purpose. And when they are not, we want to be able to take steps quickly to help them overcome any barriers that they're experiencing. So the process is going to begin with identifying an issue or a barrier, and then making a referral from the teacher, or it could even be a home, it could be a family member making the referral, but most likely it's going to come from the classroom, to the school-based team to begin to develop strategies as soon as possible. The referral will go to the lead member of the school-based team, who's going to pull the team together, and they're going to determine steps to assist the student. And our hope is that with a concerted effort and immediate communication with each other, that many of these issues can be resolved at that level. But if not, the lead will then submit a referral for any community-based services that are needed and indicate the specific needs and services that they're likely going to require. So this referral is going to go to the assistant leader of the district, which is a position that we're getting in place any moment now. It should be sometime this week. And that person will pull together the community-based team members and have them assigned to the case. So the community-based members will report back to the school lead and continue to partner with them as they work towards a solution. So all of the activity is going to be recorded in weekly logs, which are going to be monitored by the CARES lead of the district and also the assistant lead. Schools right now, we just did a training, and they're setting up their weekly meeting schedules this week. The meetings will allow the teams to discuss progress, determine next steps, and assign tasks, which will be checked from week to week. And then finally, each member in the community and in the schools is going to keep an individual log to track their own information and data that we can review and refer to as needed throughout the process. So we've helped CARES team members in training sessions to understand all the work that they are doing isn't really different from what they do throughout the year, but that it's done in a timely manner and it's done with much more collaboration in order to expedite the service delivery and get students back on track as quickly as possible. So that's just kind of an overview of the process. We have several forums for each of these, and we started that with the training Tuesday, and we have another one tomorrow morning at 8. So, Effie, if you have any questions about that?
Yes, I have one. So for a referral, how many, like if a student isn't logging on, do we have a certain cutoff or a certain number of days where that a referral should or could be made?
Mm-hmm. So what we're wanting to do is not wait at all to start taking action. So even from day one, if we see that there's someone who's not showing up, we're going to begin in the classroom first. And we've helped not just train the CARES team, but train schools to understand that teachers can start reaching out and do everything they can to reach that student and family. And that can be a phone call, email, and they're going to exhaust every option, which is what they normally would do during the school year. And so after that goes on and you don't have a response, that's when you would go to a school member who may or may not be a CARES team member and try to get their help in getting connected with the student. And if that doesn't work, that's when it's going to turn into an official referral. All this is going to happen very quickly. We're not going to wait for a week to go by and say, oh, the student hasn't been here for a week. So when we have the 20-day no-show process that we have every single year, we kind of expect that the first week there's students who are going to trickle in. We know that a lot of students don't show up on that first day. The way we've been helping people understand this is that really time is of the essence, and we need to make sure that they're responding and reacting and asking for help on day one.
So this is Board Member Jones. So if I'm understanding that when we talk about the CARES teams, underneath the CARES teams, we have the remote learning centers, right? That's part of the CARES team.
It is part of the model, yes.
Okay. And so am I understanding that that's not for, if I were a parent and I just felt like my child would need to go here, it's a referral process?
You don't have to be referred to the CARES team to be able to access the sites. So you can go there. That might be the way from the very beginning that a family is going to know that they need that service, they need that internet connection at that site. It doesn't have to go through the whole CARES team process.
Okay.
They can do that without a referral. Now, we're going to get into this a little bit later, but we do ask that families make a reservation, because what we don't want happening is we don't want 50 or 60 students showing up for a place that can only accommodate 15 people.
Okay, totally.
So we have a process for that, but it doesn't have to be a CARES referral through the school.
Okay, thank you.
Did Ms. Kaplan, Board Member Kaplan, did you have a question?
Well, I just wanted to just make a statement that I just think this is such a wonderful program that I would like to see parts of it embedded long-term into our district. I just can just see so many great outcomes, once we can get back to normal.
Yeah.
I just think it's going to be something that we're going to want to do long-term, hopefully.
I appreciate you saying that, and we've been talking about that ourselves, and when we talk to schools, like, this is what we should be doing anyway.
Yes.
I don't see, this is a way of thinking and a way of working that's really, again, a model that we can do ongoing. I don't see any reason why we couldn't.
Great.
Mm-hmm.
I like that. Thank you.
And I'll add to that the school-based part. The community-based part might be a little different because we're having to get extra funding for that. But in terms of the school and the way we work together, definitely this is something that's doable.
Great. Great. Any other questions on this part of the presentation?
No, can I just say that I've gotten a couple of text messages from folks who are listening into the call. They're saying that the audio is really bad, so I just wanted to say that to somebody. I can't control that.
I'll alert Channel 2. I'll let them know.
Thank you.
Okay, we're ready?
Okay, Effie?
Okay, hi, good evening, board members. I'm Dr. Harrison, Chair Woodbury. Give an update on Remote Learning Center supporting classroom instruction. So on Wednesday, as I had stated on Tuesday, we met with several agencies regarding serving as a remote learning center within our highest needs areas and across the county. There have been YMCA, rec centers, and imprints locations that are ready to open on Monday. These sites have been shared with our communications team to share on the district's website. And to be blessed through our other communication channels. As a result of the conversation on Wednesday, we have asked churches and nonprofit organizations that plan to operate as an in-time remote learning site for students to notify Charlotte Lindell with Forsyth Promise or Cheryl Wright with the district their plan to move forward, their anticipated opening date, and the number of students they will serve so that this information can be shared with families next week. As sites get structures and protocols in place, complete the necessary requirements so that they can be vetted sites that parents and families will feel comfortable sending their child to. We will add to our list of options that communicate with families. In an effort to not overwhelm these sites at no cost, the sites that we are working with now will not charge families. The district will have a registration process. This process will also be communicated with our families so they'll know how to have access and sign up for a site that is in closest proximity to their home or to their work location. We are asking for some patience and grace with the sites that are trying to open at no cost to families in the targeted areas, because many of them have not operated a site in this manner and will need to solicit volunteers who will clear a background check and create an emergency operation plan so that they can do everything possible to keep students, staff, and volunteers safe. All sites will receive breakfast and lunch daily, and SROs will be notified of all operating sites so that they can frequent and assess for any safety or security concerns. We've been in collaboration with our local university partners in regards to tutors, Winston-Salem State University, Wake Forest University, and Salem College. Due to their start date and safety protocols that they've put in place for their students to shelter in place for 14 days. I know Salem and Wake Forest both are requiring students to shelter in place for the first 14 days that they're back on campus. Any students hired through these universities to tutor that would go out to these remote learning sites will begin after Labor Day. And so that's just a brief update of where we are with the remote learning centers. And I know it was asked, could we share? And so Grant is working to get those up on the website, but I can definitely share the list with Sam so that he can share with board members. And it will be a Google spreadsheet. So as sites come on, that sheet will update, so you'll continuously get the newest updates in real time.
And Effie, I wanted to, the 800, there's a toll-free number that parents can call if they're looking for more immediate seats from daycare centers or other like YMCA or daycare center types. And that number's already been posted on our website.
Absolutely.
I think we had a question for Board Member Jones.
Yeah, so we're, so do we have any, without having seen the list yet, do we have any sites that will go, that will come on board with the start of school on Monday, or will all of them pretty much be a delayed start?
I'm sorry, I had to unmute again. I apologize for the delay. So yes, we have several YMCA locations, rec center locations,
Okay.
And imprints locations that are ready to start on Monday.
Okay, great. And so we can find that, maybe that 800 number for some of those immediate needs. Maybe if Sam can share that and then that list with the board, because I know a lot of times when people email us, that we might be able to just share that with them directly and help with the communication.
Okay, I will share that with Sam just in just a few minutes.
Thank you.
Any other questions for Ms. McMillan? All right, thank you.
Thank you.
Effie, did you want to continue with the training before Sharon Frazier speaks about her work?
I apologize. I had went straight to trying to share sharing the file. I'm trying to be timely on getting it.
Thank you, Effie. I appreciate you trying.
I apologize for that. Forgive
You were
me.
doing your
I know y'all tired of me asking that question.
No, it's perfectly fine, and I know families are eager to get that information, so we definitely understand. So yes, I will speak briefly about training and education. Training is taking place we did the school-based team on the 11th. We have the second group that will be trained tomorrow morning. So at that point in time, we only invited leads, and they will train the team and provide the information to the entire staff. So the second session will be completed tomorrow morning. Sharon Frazier is going to speak more about parents and the trainings that she is creating and will be sharing with families. And the learning centers, we again indicated that we met with them again on Wednesday. We gave more information about how their sites can support instruction. Gave them information from instructional services on down to a litany of other things to help them make a great decision for their organization and to know how to move forward with becoming a learning site if it is the right time for them to do so. And if they're unable at this point in time, other ways that they can support our students with partnering with other agencies or just a number of things that came out of that conversation. So that's the training and education part.
Okay. Any questions?
Sharon is going to share, Sharon Frazier is going to share what she's doing for parents.
Okay, great. Thank you.
Board Chair Woodbury, I just wanted to say that the work of engaging families has shifted in the last 48 hours with open houses taking place. So as our families realize we are literally coming into their homes starting Monday, when their kids turn on their devices, cameras on, our families are anxious, they're concerned. Our kids are too. So we're shifting to answering lots of questions, trying to make sure that all of the information that is out in the community, that parents are getting accurate information, because we're working with remote sites, but there are other well-meaning community groups who are also providing services. We want to make sure that our families are getting what they need. So again, sort of shifting from really trying to get sessions going. We will have some starting after this weekend to inform families. But right now it's more talking to families on the phone, to be honest, emails, communicating through pastors and grassroots community people, just to, again, make sure they're getting information that will be helpful to them to start on Monday. So we do have the sessions that will start. We're able to collaborate with technology and other district departments and divisions to make sure that that information is getting out. But right now it's more street, community level kinds of activities, which are pretty intense. And you know that from calls that you get. So, thank you.
And if I might, Chair Parker, make to our Chair Parker, or Mayor Parker, if I can make a comment. One of the things I think that may have not been mentioned relative to engagement, and thank you, Sharon, for that feedback on the parents. Andy Kraft, with accountability, will be running reports. He's already set up a report so that he can run regular, consistent reports based on sign-in. So we won't wait for teachers who may be really busy, principals who may be really overwhelmed with the first week to get those names. He's going to begin monitoring that from day one and pushing out those reports to the lead. So I just wanted to let you know that this team will be working with his department to monitor. And then, and I think Mr. Pesh may or may not have mentioned it. I was paying attention, but I sat through the training, so some of this runs over. And in going through the training, one thing that I realized is we'll be keeping good data on students. And we do not want to confuse this process with what we call the MTSS process, where we provide interventions and supports for children. This is totally engagement. This process is to ensure children are connecting, that we solve problems throughout the process. We're able to get into the neighborhood to determine if they have a Wi-Fi access. 2 of our neighborhoods had a donor provide internet access for the entire 2 apartment complexes, just by sharing that the need was there. So want to, highlight the investment our community has made in giving access. But I did want you all to know that we will bring you back regular reports from this team, and this has been a great team to come together under Mr. Pesh's leadership, and Effie, I think, has been working on sites since about May, but just wanted you to know we will keep the data.
Ms. Parker, I need to ask a question just on well, first of all, I just want to say, I know Sharon and her folks are working extremely hard. We know your work ethic, Sharon, and I'm sure you are on the phone and all your people making sure our parents know what's out there for them. We appreciate all that you've always done to advocate for our kids and our families. Back to one more question about the CARES sites, and when we talk about and I don't know if this is for Effie or, but we talked about YMCA's, we talked about some imprints, some Parks and Rec. When we get the list, will we know if there's a charge for that site, or are all the care sites free? Because I think that's going to be the other question. I know that I'm being asked, I'm sure other board members are as well. Are some locations free? Or some locations have a fee? What does that look like?
So the Y locations, rec centers, I'll double check on the rec center, and imprints are charging a fee. Okay. For students, and they had to enroll in those sites. But we've been working, Cheryl White has been instrumental in working with the Y and imprints. Okay. The groups that I've been working with diligently are our faith-based partners and nonprofit organizations that want to assist and support in some type of way. Mm-hmm. And they have been working really hard to try to figure out, they have the space, but to figure out how to open their spaces safely, especially depending upon the financial means that they have. Like, there are a lot of factors that they've had to weigh out, liability, just different things. And so between myself and Charlotte Lindell with Foresight Promise, who has been such a great help in this aspect, we've been trying to working really hard with them, just keeping those lines of communication open and helping them think through and problem solve how they can move forward. I think with the new provision that we just found out about on Tuesday that gave the waiver around child care license, and then place liability where negligence falls, whether it's with Foresight Promise, the school system, or their site. The site helped to change some of the help with some of the anxiety and hesitation with moving forward as well. So I think we're really at a good turning point, and they're eager to move forward and just getting all of the pieces in place. And so just in our work together, we, on both sides, we just try to be as flexible as possible and have as much patience and grace as we all try to deal with this unprecedented time, knowing that it does add some challenges in the midst of while they're trying to do all that they can possibly do to support our students and families too. So we're getting there, we're closer than we have been in the past. So very hopeful that what we've asked is, can they start on the 24th or 31st? And if they can't open by one of those 2 dates, a couple said, we've got some work to do. Can we open in September? Still having that flexibility. And because they've got to think through what their capacity is and get approval from their boards as well before they can open up. So it's been a lot of great collaboration and dialogue, but we're getting there. Okay. I just wanted to clarify that with the fees, so thank you. Yes, those sites, those churches and nonprofits are planning to open at no cost to families. Right. Okay. Thank you.
Any other questions? All right, we will move along. Are we to the second, are we to reopening schools, the metrics, Bill Powell and Jan Atkinson?
Very, very good. Sam, are we up next?
Yes, sir.
Yep,
Okay.
got it up.
Okay. Good afternoon, Chair Parker, board members, superintendent. This is a phase talking about level of community and school spread of COVID-19 and learning models, trying to tie them together a little bit closer. In here, this is a large group for a lot of people assembling information that become a part of this. First, we want to talk about as the county's cases rise and fall, we got to develop levels of learning that can go between the levels as the cases rise and fall so that the community can plan ahead. Another thing that is out there is there are a lot of different measurements and metrics, and as you go to every district, every state, they all have something a little different. And they're all tailored individually to their school or school district. Ours would have to be the same way. The state has not identified exact guidance on metrics, meaning numbers and percentages. If you look at most of the governor's things, it deals with number of hospitalizations, number of cases, number of tests, and there are a lot of factors. But the good news is they're starting to align. So with this model, we tried to tie back the state's plans. You recognize the colors ABC, and we tried to move that as you go from the top of the page to the bottom. So with Plan A, what is Plan A? That ties to the CDC, health departments, many others about isolated, very important, case investigations, little or low evidence of exposure in a large community setting, and obviously the schools have to meet protocol. And then the bottom line is in-school learning with type A. The middle plan B that we're all in some respect is moderate spread mitigation, meaning sustained or declining transmission. There's a high likelihood of confirmed exposures in community and potential for rapid increases. I think we've seen that after the couple of holidays, so that's how that ties. You get a CDC talks about a 5% positive rate 2 weeks in a row, and positive cases trending downward for 14 days. And then we have facility health and safety protocols. And then we can go into the models that we have about hybrid or distance learning. We're in one of those right now. And then Plan C goes into significant, more than 5%. It is neutral or increasing, and remote learning. That's where we were last spring. Next slide. So we're going to focus on B, which is where we are. And that's the moderate social distancing, meaning we're enforcing social distancing. And we can either do remote on the right, and teachers and staff can use school buildings. We can do hybrid. In this case, hybrid means practice social distancing. And it could be a mix of different learning models. And it could alternate between students and teachers using the buildings. You could have AABB. You could say K3's in the building. There are many things you can do to accommodate the social distancing. Next slide. This is just an update of where we stand. This came from NCDHHS. And you can see our cases in comparison by the state and the other counties. Forsyth County is really generally aligned with this information, so the state and the county are aligning well. Next slide. I'd like you to just glance at the formula, and then Sam, I think we need to go to the next slide, and then I want to go back into this one, if we could. Because can you go to the next slide, Sam?
Okay.
Okay. And I'd like to talk about how is it possible to turn a school district on a dime with 55,000 students on a week's notice. We got staff and public, and we know on a snow day there's an advanced plan. So if we think about a plan, let's think about a model that can accommodate. So I'm going to talk about the right-hand side of this chart, and you see a lot of numbers in the middle, and then you see a chart on the right. And we started in March, and we had some cases, and then we grew, and then right around Memorial Day, we started getting an increase in cases. So this is for Site County's numbers. This is not the state, this is our county. And you can see a bump, 14 to 21 days after Memorial Day. Then the number of cases down, and you can see it drip down. And then after the 4th of July, and we had some protests in the 4th of July, and you can see mid-July, the numbers were up there. And those numbers is mid-July. Now that's when the Board of Education and the superintendent recommended mid-July to let's go remote. So you can kind of see that aligns with the peak of that chart. And currently we're moving downward. But if you see the up, the down, the up, and where are we going? So what do we got? Labor Day weekend's coming up September 1st. Are we going to do the same thing? Following that, you've got Halloween a month later. Following that, you got Christmas and Thanksgiving. So is this the trend? Is this what we're going to do? So how can we develop a model to move so we aren't saying we're open, we're closed? Can we do something in between? So let's go back to the previous slide, Sam. So what this does, this happens to be a Minnesota, and it is an idea. It's a concept. And it's how can we develop a model? It's not developed. How can we develop a model for a tiered or phased approach to opening and closing? So if you were to look, the top one that says 0 to X cases per 10,000, just to the left of that, just pencil in your mind, Plan A on the state. And then if you went to the bottom, which is remote learning, the very last one, you put C, because that means we're closed. So B is, this is possibilities. It's not defined, but it's different ways as you get from fewer students at the top to more at the bottom. You get a little more in the building or a little more at home. So the second one is in-person learning for elementary, hybrid learning for secondary, 6-12. Hybrid meaning strict social distancing, not necessarily remote learning. The next to the bottom is much more strict, meaning hybrid learning for elementary. So purely in elementary, if K3 can be social distance at 6 feet apart, 4th and 5th may or may not, many schools can, some cannot, and then distance learning for secondary. So and then the middle one is hybrid learning for all. Hybrid in this model that's right here is really pure social distancing. So there's a lot of educational models and ways instruction will approach it. But if we can establish numbers on the left that say, you know, you've got less than 5%, then we're up there in less students, and more than 5%, which is where we are. And then we can imagine that chart. Can we phase between them? So closest to there, none, you have more people in the building. And as you get more students, you start saying, some are going to have to stay home. We're going to spread students out. And then as you get to the top, we're going to move to distance learning for secondary. And we're going to do elementary social distance. So this is a model. We're going to try to develop, we've had 2 meetings with the health department to try to get the numbers on the left and get the state and the county and where the country is aligning on what is a level that may be workable and what's a level that really doesn't. We got another meeting tomorrow with the health department to talk numbers. And those numbers can be used to try to create, so it's a standard of cases per 10,000 over 14 days. So let's go to the next slide. So I want to talk about that chart on the right. And the solid line is the real number, and that dotted line is a trend going, if we spread it over 14 days, can we forecast where we'll be in a week or 2 weeks? So we can't just say, well, the cases are up this week, so let's close school this week and let's open them next week. So it may be over a period of time we can phase in, and if the cases start going up over a 2 or 3 week period, then maybe we pull back a little bit. Or if it gets into the month trend, we may have to start more serious. But if you look at that right-hand line, you can see where the trend is taking you. So that's the purpose of this discussion, is to say, if we can slowly find a way to ease the water faucet open, let the kids come in, and then slow it if the cases start accelerating considerably. So I think at that, maybe take your notes and then let's go to the next slide, because there are a couple of different ways to look at it. This is a little bit different. This says 5% positive, trending downwards, and the state and local show trends. We're trying to get a little closer and get, can we do it a little differently? This came from RTI, Education Workforce Development. It's a model. Let's go to the next. So that's metrics. Now we're going to talk about safety protocol in the building. This slide came from a lot of people, and Michael and the wellness and operations and transportation and food services to develop a plan ensuring, and this is the high level, necessary PPE is available, cleaning supplies are available and established. We're prepared to be in the building. We have screening procedures. We have how to respond to students. We're set up and ready. Health and safety are in place. And to ensure that ridership, parents, how to get the students there, how to take them back. So a plan to do that. At the bottom is a link, which is a checklist. You can call it an audit of the buildings. Sam, does that open for you, or is that, if you click on that link?
Testing it out.
Okay. We did. Yeah, okay, I see. He's trying, because we did proof it out before we got on this meeting. And it's a little more detailed. If not, if it doesn't want to open, Sam, you've got the spreadsheet somewhere, right? Lisa sent it.
Maybe.
Same one with the presentation. It's not cooperating.
No, it's not. Why don't you keep rolling, Bill, and
Okay.
we'll come back to it.
We'll come back. The highlights of that audit checklist, I'll just hit the highlights. It goes through protocol of entry and exit points. Do we have it set up? Do we have the staff? Do we have sanitizing solutions? Screening teams, are all the people there? Have we trained them? Are they properly PPE equipment, entry screening, which doors, where do we go, transportation, how do we get on the buses, proper materials, is everybody trained, classrooms, what's it look like, how's it work, offices, break rooms, work rooms, offices, are we set up with the shields in the front, isolation and health, they're different, how and how are they used, CARES teams for the responses, the cafeteria, is it set up, are there meals in the room and clean up, gymnasium, how we use it, playgrounds, are we going to use them or not, depending on the level. But all of that is in the checklist. But that list is available if we can get to that link there. Do we go to the next slide, Sam? Are you working
Bill,
on
are you
it?
seeing the checklist now?
I am not.
Hold on. It finally opened
Okay.
somewhere. Sorry, Bill.
If I get cut off, it's building a heavy thunderstorm right on top of me.
Let's just roll with the slides.
Okay. So the next one is really this is the guidance. These are the sources that we use with CDC should we have a school closing or reopening. So in between these peaks and valleys of high and low cases in Forsyth County, these are some of the agencies that would guide us in opening and closing, and we need to develop a metric. This is really just a checklist for, we got all of these to meet. Next slide. And in the first 6 weeks, superintendent and communications want to develop a community impact and reassess and resurvey. How do you feel about opening? How are the buildings looking? How are the trends going? And how's it coming together? Go ahead, Dr.
So if I can jump in, Bill, what we were charged with doing is sort of devising some sort of metric for determining, okay, are we transitioning back? And when we looked at that, it was really 3 parts. One is to develop an algorithm, and the algorithm that you saw, the formula, was suggested by the health department that we take a look at a 14-day trend, so that if things change, as Bill said, one day we're working on trends as opposed to the spontaneous nature of positive tests. And looking at the algorithm that will work for us, we also have another agency that will start to information share within the next month and give us data. But using an algorithm to say that at this point, 5%, we may not be at 5%, but this is where we're trending, and where we are has either stabilized or is too sporadic for us to make a decision. That in combination with the audit, the facility audits. So the checklist there, I'll ask Sam to separate the checklist and repost that to our website so that our community can see the checklist. So we'll separate the 2 documents, and the checklist was put together by the team, the health and wellness team, to really, and we will go on buildings and have teams that go on buildings before the end of the quarter to ensure that we have all the proper safety measures in place. And then finally, staff perception and staff safety. So once school starts, we'll ask our principals to convene committees with teachers. We will have a district-wide re-establish our committees with teachers and employees and talk about the types of activities that need to occur so that teachers feel comfortable and staff feel comfortable. And as you're aware, the last survey that we provided demonstrated a lack of comfort from several employees. So we're working through that process. So the 3 areas combined, what we're proposing that we look at, and we'll bring back to you before we get back to the point where we're looking at moving to Plan B. So it's not a puzzle piece, but it's sort of a triangulated approach. That the three metrics: we have to have teachers in the classrooms, we have to have employees in the classrooms, we must look at the trend of community spread, and we really, I've tried to on community talks say to the community that if you help by adhering to some very basic, requirements, there it is. It's actually not triangulated. It's a puzzle there. Looking at community spread and also the budgetary needs. And we are happy that there being some additional dollars released for those health professionals, hopefully in the school system that can help with screening. So some additional dollars flowing to the health and wellness, facilities readiness, which is the audit, the school safety piece, and then, of course, community spread, which is the algorithm that you saw. All these pieces, when we put them together, will help us make a better decision about transitioning children back. Board Member Jones, I think you had a question.
I did. I know that right now we know that many of our teachers have expressed interest in being in their classrooms so that they can use that technology that's in their classrooms while they're teaching in Plan C remotely. I know if they need to make accommodations for their own children, that they will most likely be probably in the building. And so I know it's not on the same scale, but are we tracking per school the teachers that are there every day, even with maybe students in the building?
We are. In fact, a survey was sent out by our deputy superintendent in areas this past week so that they can project out the number of teachers that will be in the building. But as the weeks, as we progress, we'll do a more physical count once we get started.
Well, and I'm hoping that maybe that would help as we're starting to see that, and maybe even some of these things that we're talking about. I'm assuming that it's not on the same scale as a full check-in with the building being in like a Plan B, but I'm assuming there's some type of screening there. What does that look like? I'm just saying all that to say that I hope that we could use some of that as maybe a little bit of a very small trial run, but how that's working, and then what that looks like when you have that many teachers and maybe other classified staff in a building to kind of help. I know it's difficult. It won't be like the full transition, but I definitely want to see us try, once we can get there, to see us get to a version of Plan B, at least in that second quarter, hopefully, and maybe just by having adults and students in the buildings now, that'll just help us tweak that checklist and know what's working and what's not working.
I agree with you, Board Member Jones. Transitioning back into an environment you haven't been in since March and you left in such a hurried fashion can be somewhat unnerving. Mm-hmm. But what we've heard from not only our students, but also from our teachers, is they want to be involved in the decision-making process. So Darryl Walker he's gonna do a couple of walkthroughs, and maybe the next meeting we'll bring back some photos of the screening process, which is required right now. I screen every day myself coming in, and they have a QR code which you can answer your questions, take your temperature remotely, so the person who's in charge of the screening can sit away from the staff. So it's a very good process that's been developed. But we'll involve them in the process. So again, the facilities readiness, ensuring that we have the algorithm, including community spread, and encouraging our community and letting them know that if we want to get the percentage, if we want to get back in school, we need to work together to get the percentage of spread down. And then, again, staff sensitivity to staff, because we know we need our staff. So we appreciate that. And the purpose of this presentation, thank you, Mr. Powell, so much, is to just let you know we are working on some sort of systemic approach that we can share. It's not, I don't want people to think that we're randomly deciding one way or the other, but it's a systemic approach to making decisions about, although we move into B second quarter, if it gets to a certain point, we may have to decide, well, it's time to, beyond positive cases, we may have to look at closing again. Well, what did we do to make that decision? So we have some agreed upon formula for making a decision versus, we're just not feeling very good about whatever it is, okay? Thank you.
Any other questions for Mr. Powell? Dr. Hairston? Okay, we'll move to the next. Ms. Atkinson, are you going to present anything, or was that a duel on both of you?
That was a duo. That was a dynamic duo. So he took the lead this time.
All right, great. Thank you. Then Sam, we're ready for the next agenda item. Is that correct?
Yeah.
I'm sorry. I didn't.
Dion Jenkins with contact tracing.
Good evening, everyone. And Sam, do you want me to pull up mine, or are you going to pull it up?
Whatever you prefer, Dion.
Okay, I'll try to pull mine up and drive. And if for some reason something breaks down, just maybe you could be back up.
Got it.
Are you all able to see my PowerPoint? Uh-oh. Went into wrong mode.
Went into small mode, yes. Now it's almost full screen now, Dion.
I'm not sure what happened with why it went into that mode. I apologize.
That's okay. I think we can see this if this is.
If you all are okay keeping it in this mode, we'll just rock on.
We can see it.
Is everyone okay? If I can see it, we're probably pretty good. So.
Alrighty, I'll try to make it as big as possible.
There, I think you're good. Thank you.
Thank you. Chair Parker and members of the committee, thank you for giving me an opportunity to provide you an update about our screening process in the district, as well as our contact tracing protocols. As you know, the Department of Health and Human Services set forth certain requirements for school districts, and we're required to devise a plan based on Plan A, B, or C, depending upon state metrics. It's important to note that under either plan or any of the plans, there are certain screening protocols that are required for anyone entering into the building. That's employees, students, or other adults. And school districts are also required now at this point to ensure that all students and employees and adults wear face coverings whenever they are in the building. And so when it comes to our daily screenings, according to DHHS guidelines and requirements, the following individuals are not allowed to enter the facility. And these are actually factors that are being assessed in the daily screenings. A person who's had close contact in the last 14 days with someone diagnosed with COVID. And again, close contact is defined as being within 6 feet of that person for at least 15 minutes. A person who's been advised by a health department or a healthcare provider to quarantine because of potential exposure. A person who's been diagnosed with COVID, even if they don't have symptoms. And a person who's been who has had at least one of the following symptoms: fever, chill, shortness of breath, or difficulty breathing, a new cough, or new loss of taste or smell. So the screening questions are designed to assess whether or not individuals entering into the building fall into one of these categories. At the current time, we have developed a screening process for employees and adults. We are still working on finalizing the screening process for students and what that's going to look like. And so we will definitely have an update for you once we finalize that process for students, because it would ultimately, when students do come back into the building, it'll be a little bit different process. But as of right now, for employees and other adults that might come to the building, we have 2 screening methods. The preferred method is when the employee takes their smartphone device and they access this screening questionnaire via a QR code. And so in each of our school buildings, we have signs posted in the front entrances that has a QR code. And so when the employee holds their phone up to that code, they will be taken to a Google form that contains the screening questionnaire. One of the questions on that questionnaire also asks for the employee's temperature. And so we have thermofast thermometers in place at our school facilities so that the employee can put their head close to the thermometer, not touching it, but close to it. It'll read their temperature, and then they input that in the questionnaire. There's also screening teams at each of our facilities whereby a staff member is responsible for kind of supervising this and making sure that employees complete this QR process, that they enter their temperature and properly enter the building. If for some reason the employee's temperature was higher than 100.4 degrees Fahrenheit, then there would be a notification on the thermometer that indicates that they did not pass that test, and the employee will be instructed that they have to leave the building and contact their supervisor for next steps. So if for some reason an employee does not have a smart device, or if it's a visitor or some other individual that comes to the building, they will be asked to conduct this questionnaire via our backup method. And in this process, the screener will ask the employee a list of questions, the same questions that the employee would fill out on the QR code, ask the employee or the non-visitor those questions, record the answers to those questions, take the person's temperature with a handheld infrared thermometer, and place that information on the report, and then confirm that they are wearing a mask. So I mentioned earlier that schools have been asked to identify a screening team, and this team consists of at least the assistant principal and 2 other individuals who will be responsible for kind of rotating and supervising the screening process whenever anyone enters the building. We did conduct training for these screening teams on Monday of this week, and those trainings have been recorded so that if anyone missed that training, they would be able to go back and review that at a later date. And as I mentioned, we're in the process of finalizing the screening protocols for students as far as where that will happen, who will conduct those screenings, and where in the school facility those entry points will be placed. And so once we finalize that, we'll conduct a training in the future. So when we talk about contact tracing, the screening process is an important piece of contact tracing. And that's because not only does it, if it works, effectively prevent people from entering into the building who have these symptoms or who potentially have been exposed, but it also creates a record of who comes into the building and at what time, so that in the event the health department has to engage in contact tracing, we can narrow down who those people are that may have been exposed. And so contact tracing is just the process of trying to identify individuals who may have been exposed to someone who has tested positive for COVID-19. And again, the definition of exposure that they will use is within 6 feet of that individual for 15 minutes or longer. When it comes to contact tracing, we rely heavily on the support of the local health department to conduct this tracing, and we make sure that we collaborate with them as needed. So when it comes to employees, if an employee tests positive for COVID-19, they've been instructed to notify their supervisor immediately or as soon as possible when they learn that information. And then, of course, according to our screening protocols, that employee will not be allowed to come to work or school until they can meet the criteria for returning. That supervisor is instructed to notify Human Resources, and then Human Resources will reach out to the health department, make the reports that are required by law, as well as work with operations to ensure that cleaning and sanitization occurs. The health department is actually the entity that will facilitate the contact tracing process, of course, with the collaboration of the district. The process for students is very similar. If a student reports that they've tested positive for COVID-19, of course, since it comes from the student, there needs to be some verification of that information with the parent or guardian. But then once it's confirmed with the parent, then a very similar process occurs. The school administrator or whoever it is at the school level that receives that report is to notify human resources, and then human resources will take the same steps to report the information to the health department, collaborate with operations for cleaning and sanitization, and then cooperate as needed for the contact tracing process. And so I have here an infographic that is designed to kind of illustrate in a more simplistic way the potential for how COVID outbreaks within the schools can happen and what that contact tracing process might look like. And so again, this is a little bit more simplified of an example. The example here includes a student in elementary school that's in a class with 14 other students and one teacher. And if that student were to test positive, then the potential to contact trace extends to all other students in that classroom if they meet the exposure standards. In middle school, it's a similar analysis. It just shows how many people potentially would be impacted and potentially exposed. In high school, the example is a bit more complex, especially in a scenario where students switch classes and interact with other groups of students. And so instead of exposing 15 other students, for example, if a student is exposed and they've moved from class to class to class, then we're talking about a larger number of students that would have to be identified in the contact tracing process. And so the numbers can grow much quicker and much larger in a setting where students are changing classes and moving and interacting with different groups. Of course, as I mentioned, this is a more simplistic example. This just shows how it could potentially, how contact tracing might occur based on classroom groups. But as you know, throughout the school day, depending upon what model we're under, students and teachers would interact with other individuals potentially in the hallways or during lunch and that sort of thing. So just wanted to provide this example to show what that contact tracing process might look like in a school setting. And so with that, that's my last slide. I'd be happy to answer any questions that you might have either about our screening process or our contact tracing protocols.
I think Ms. Bramer, did you have your hand up?
I did. We've been focusing a lot on classrooms and hallways and 6 feet, because that's what's basically been given to us. But I'm concerned about bathrooms and cafeteria. And I'm wondering, do we have anything wrapped around how long it sits inside the bathroom with students going in one at a time, in a very narrow, confined space, and the potential for a long line in the cafeteria? Do we think there's any possibility we can use a menu system to try to work around getting them all in one small confined space again?
The students would eat in the classrooms under Plan B. There was some discussion at one point about students going to the cafeteria just to give them a break to get up, and we've ordered some floor markers where children would stand on floor markers as they went through the hallways. But right now we're looking at children eating in the classrooms. We had not talked about restrooms. I don't know if Daryl or Lauren, if you want to chime in about the restrooms. I'm not sure if they're on the calls, but we hadn't talked too much about restrooms. And Bill and Jan, anyone who's been working on this project, if you've had that discussion, please chime in.
Good evening, this is Lauren. There is actually guidance in the NCDHHS toolkit that the floor markers that Dr. Harrison mentioned have to be in the student restrooms. The social distancing signs as well, in addition to hand washing signs. And one of the additional instructions there is to measure off the sinks in those areas so that there is that reduced capacity in the bathrooms to have a smaller number of students in that space at a time, and to formulate lines outside of the bathroom where those students can social distance and they are not having close contact as they move in and out of those spaces.
Okay, and that's I like the sound of that, but I'm concerned about the amount of time it could take for, especially like in an elementary school, to line up in the hallway and how long that line could possibly get. So we looked at options. I know it sounds really insane to say this, but possibly using porta-johns or other methods so that we can actually spread that line out.
This bill, you're also going to be occupied at a reduced capacity in the school building, so that'll take some of your factors out, right?
50%, correct.
Yeah.
But that's still a lot of kids.
Well, I mean, we indicated 50%, but we could even go lower. It really just mentions reduced density. And so density could be what's capable. And sometimes if you have a elementary school with 300 students, 150 students might be easy to work with, but we know that many of our schools are very large, and so that might, and that's why I think the technology that Mr. Sherrill presented at the board meeting was important, because now we can focus on having a good number of students in the building, and rather than just focus on 1 or 2 days, maybe it's 1 day that we can safely accommodate students, and then they can still have access to the teacher. To me, that's why that is so incredibly important, because it allows us some more flexibility.
And are we still going to look at using the pod, like at Jefferson Middle, they use the pods? Are we still going to be looking at that pod system, or are we going to do just the hardcore building?
I don't know, Bill, did you include the pods in your distribution of students?
Yes, pods, trailers, it's all in there. Pods have restrooms also, so they'll have their own set. And a reduced capacity, a great help. Many times, like the busy times in schools, were elementary in particular, were around lunch. And every teacher wants to stop at the restroom on the way back to the class or to there. And some schools spread out their bathroom breaks. And it was a defined moment. So, but we do have quite a few restrooms.
And that was just my concern. It might have to be, especially with little ones.
Ms. Framer,
That's it.
are you okay with that? Okay, good. Board Member Jones, I think you had a hand up, is that correct?
I did. I just, as we have some large schools, and not knowing what those numbers are right now of staff and potentially their student that's with them in the building, I'm just making sure that that some of this is in place. If we're concerned about that, to bringing students back in, that we're doing that now. That I'm assuming there's no going to the cafeteria. If people are in there working, they're going to have lunch there. They're not using the staff room and all that same kind of stuff. If we don't want the students in the building, that those that are in the building are following this exact same protocol.
Yes, ma'am. Yes, ma'am, they are.
Okay, good.
Even with their own children are remaining in their classrooms, but they're screened as well.
Great.
This is Ms. Framer again. I have just a concern, thinking through these processes. When somebody gets a hall pass to go to the restroom, if we're using a time schedule to get them in the hallway and get them through that restroom line, it might be something we just need to mention of, if there is a schedule, how it's available for the teachers to send students to which restroom during the middle of class. Because if they're in the middle of class and they need to go, there needs to be something to monitor that process.
Good point. Thank you so much.
Any other questions for Ms. Jenkins? I think you alluded to this, Dr. Hairston, earlier, but you had said that we were going to have maybe an opportunity to see, they were going to go and maybe film some of these processes in place, with the app and all of those things. Did you allude to that earlier, or were I just dreaming that you said that?
No, yes, no, you didn't dream. We'll certainly have that for you, that process. I thought we had some pictures of that because that was something we were getting out. But it's a pretty unique process that I think I'd like to thank the team for. And if you all come to the what visits or whatever, you're going to have to pull up your phone, take a picture, your QR code, your questions come up, you take your temperature, remotely, and those processes are in place. So we'll make sure we get that out and published for people to see. Mm-hmm. So I apologize.
That'd be great. I think
yeah.
This would probably be a good time too to get the kinks out of that while we're having fewer people in the building right now, and so we can learn what we need to do and not do, or whatever. So that'll be a good learning process for.
Right. We've had to practice. People not clustering, coming in at different times. On different varying schedules, so we can work out the adult component and ensure that we're monitoring and those types of things. The cleaning is important. Some of our cleaning tools won't be in until October, and so we would have been in a little bit of trouble this week had we not delayed because some school districts have had to delay last minute because their cleaning supplies did not come in and the PPE is not in. So this gives us more time to be better prepared and work on our technology as well. Because we've got to get those classrooms with the cameras and the double technology so that we're not required to have so many students that we focus on a safe number as opposed to a number. And that may vary school to school. So we will certainly have that for you.
And as a parent of someone who's going to enter the middle school version, I think it's nice that sometime beforehand, the parent could walk through like a student so they can see what their student will do and make themselves more comfortable.
I agree.
Ms. Parker, we do have, as a part of the training for the screening teams, there was a short video that was created in partnership with Jennifer Corso from the health department. So I wanted to thank her for that. That shows how the screening takes place with the thermometer and things. If I wasn't afraid that the technology wouldn't work, I would pull it up and show it to you now, but I'll be happy to share that link with the board.
Okay. Can Brent, you help? Maybe Brent, do you have time to pull that up, or is he able to, putting him on the spot here?
If you give me one moment, I will try to find it. I'm just not sure if it will play. Let's see.
If you're nervous, don't worry about it. I want you to put up the wrong video. Okay.
I apologize, Dan. I'm having trouble finding the file, so.
I've got it, but due to the nature of how my computer is set up, it's not going to play. So what I'll do is I don't mind. I'll share the training and the link with the whole board, and the screening will be available as well on our website. So if anyone wants to go and look at it, we can certainly make that available. I apologize for not being able to bring it up right now.
That's fine. I think that it sounds really. It sounds to me a whole lot more efficient than what we talked about a couple of months ago with pen and paper and all kinds of things. So I'm glad to know that we have that process in place. I think it will move a little more seamlessly, and it will be a better process. So I think things are moving in the right direction as we're all learning and adapting and having new ways to do everything to meet the needs that we have at this time. So thank y'all so much for all of that.
And thanks for thinking outside the box, because we do know, as all of us that we've had kids in the school system, we are been in the school system, we know that sometimes parents can't get it right on a good day. So if it's on a bad day, we have to think that through too.
Any other questions or anything? Do they have any other questions, or do staff have anything else to add or anything?
No, ma'am. Thank you so much for the opportunity.
I will thank you all. This will be good, and it gives us some food for thought for the future and what we're looking at down the road. So thank you very much for all the hard work that you guys have given. And if no one has anything further, I think this meeting is adjourned. Thank you all, and have a good evening.
Thank you all. Take care. Bye-bye.
Thank you.
Thank you for joining us on Your School Channel, Cable 2.